Welcome to this video on anesthesia and patient positions, featuring the top 19 high-yield multiple-choice questions for exams like NORCET, RRB, ESIC, and AIIMS. We will cover positioning for neuroaxial anesthesia, airway management, general anesthesia, and postoperative recovery positions, along with complete rationales and explanations. Question 1 asks, which position is most appropriate for a patient receiving spinal anesthesia? Is it prone, lateral decubitus in fetal position, supine with legs elevated, or Trendelenburg? The correct answer is B, lateral decubitus in the fetal position. This position, or sitting leaning forward, maximizes lumbar spine flexion. This widens the intervertebral spaces for easier spinal needle insertion. Question 2. To prevent a post-dural puncture headache, or PDPH, following spinal anesthesia, how should the nurse immediately position the patient? The correct answer is C, flat supine position. Keeping the patient flat limits the gravitational leakage of cerebrospinal fluid, CSF, helping to maintain CSF volume and pressure, which is the primary non-pharmacological intervention to reduce PDPH risk. Question 3. What position is ideal for aligning the oral, pharyngeal, and laryngeal axes during endotracheal intubation under general anesthesia? The correct answer is C, sniffing position. This involves cervical flexion and atlanto-occipital extension, perfectly aligning the 3 airway axes for the best direct visualization of the glottic opening during laryngoscopy. Question 4. Immediately after a tonsillectomy under general anesthesia, what is the safest position for an unconscious patient to prevent aspiration? The correct answer is B, lateral or SIMS position. This side-lying position is critical post-tonsillectomy, as it allows gravity to drain blood and oral secretions, preventing pooling and reducing the risk of aspiration. Question 5. A patient is recovering in the PACU, breathing spontaneously but unresponsive. Which position is the safest for recovery? The correct answer is B, lateral recovery position. This is the global standard for unconscious, breathing patients, as it keeps the airway open and allows for safe drainage of fluids. Question 6. In which surgical scenario is the Trendelenburg position primarily indicated? The correct answer is C, pelvic organ surgery. The Trendelenburg position uses gravity to shift abdominal organs towards the chest, providing excellent, unobstructed surgical exposure of the pelvic organs. Question 7. A patient is in the lithotomy position for a prolonged procedure. This position carries a high risk for injury to which nerve? The correct answer is B, common peroneal nerve. Improper padding or prolonged pressure from stirrups against the knee can compress this nerve, potentially resulting in foot drop. Question 8. Following a subtotal thyroidectomy, how should the nurse position the patient to prevent complications? The correct answer is B, semi-Fowlers with neck supported by sandbags. This position promotes venous drainage to decrease edema and supports the neck to prevent hyperextension, protecting the suture line. Question 9. During spinal surgery in the prone position, what is the primary purpose of placing chest rolls under the patient? The correct answer is B, to allow free abdominal movement during respiration. Chest rolls relieve abdominal pressure, supporting ventilation and decreasing intra-abdominal pressure, which reduces surgical bleeding during spine procedures. Question 10. The reverse Trendelenburg position, head elevated, feet lowered, is often indicated for which type of surgical procedure? The correct answer is C, upper abdominal surgery. This position shifts abdominal viscera downward, using gravity to improve exposure for procedures such as laparoscopic cholecystectomy. Question 11. When positioning a patient supine on the operating table, arm boards should not be abducted greater than 90 degrees to prevent injury to which structure? The correct answer is A, brachial plexus. Abducting the arms beyond 90 degrees stretches the brachial plexus, risking permanent neuropathic damage and resulting in motor and sensory deficits in the arm. Question 12. Immediately after a percutaneous liver biopsy, the nurse must assist the patient into which position? The correct answer is D, right side lying position. The liver is highly vascular. Positioning the patient on the right side applies direct pressure to the biopsy site, which significantly reduces the risk of internal hemorrhage. Question 13. Following a complete right pneumonectomy, removal of the right lung, which position should absolutely be avoided? The correct answer is A, right lateral position. Positioning the patient on the unoperated side restricts the expansion of the remaining lung and risks a fatal mediastinal shift due to fluid accumulation in the empty space. Question 14. What is the best position for an infant immediately after surgical repair of a cleft lip or cheiloplasty? The correct answer is C, supine. The priority is protecting the delicate facial suture line. Placing the infant on their back or side lying prevents them from rubbing the surgical site against the bed linens. Question 15. Following a cardiac catheterization via the right femoral artery, how should the patient's right leg be positioned? The correct answer is B, straight and immobilized for 4 to 6 hours. Bending the knee or hip can dislodge the clot at the arterial puncture site, leading to massive hematoma or hemorrhage. Question 16. In the lateral kidney or jackknife position, the patient's lower leg is flexed and the upper leg is straight. What is the purpose of this positioning? The correct answer is B, to anchor and stabilize the patient on the surgical table. Flexing the bottom leg and keeping the top leg straight prevents the patient from rolling forward or backward during a nephrectomy. Question 17. After a cataract extraction surgery on the right eye, how should the nurse immediately instruct the patient to sleep? The correct answer is B, on the left side or back. Lying on the operative side applies direct pressure to the eye and increases intraocular pressure, which can rupture the surgical incision. Question 18. During the first 24 hours after a below-the-knee amputation, how should the residual limb or stump be positioned? The correct answer is A, elevated on a pillow. Elevation during the first 24 hours decreases postoperative edema, swelling, and bleeding. After this period, the stump must be kept flat to prevent contractures. Question 19. The rose position, supine with a sandbag under the shoulders causing neck hyperextension, is commonly used for which procedure? The correct answer is B, tonsillectomy. The rose position drops the head backward, preventing the pooling and aspiration of blood and secretions into the trachea during oral and throat procedures. This video has covered 19 high-yield questions on anesthesia and patient positioning critical for nursing and medical exams. Thank you for watching this video. We wish you success in your upcoming exams.